Good morning, everyone. We are very happy to have Dr. Carina Mihai from Zurich with us. Carina, can you explain us the aim and the rationale of your study?
This is a study on gangrene performed on patients from the EUSTAR cohort. We wanted to look at risk factors and predictors of gangrene in the EUSTAR patients. As you well know, EUSTAR is a very large database, currently the largest prospective database of systemic sclerosis in the whole world. And because gangrene is a serious complication of vasculopathy, we wanted to know more about it. Patients with gangrene have a big burden of disease, and treatment of these patients is also very costly. So we performed a cross-sectional analysis of the database. Gangrene is recorded into the database beginning with 2013, so this is the reason we didn't have data in as many patients, like 15,000, as there are currently recorded in the database. We analyzed actually every patient with any data on gangrene, like having it or not having it. And also we could ask the centers having patients with such data to tell us more about the cardiovascular traditional risk factors in these patients. So the question was sent to the centers and we received their supplementary data and we were able to perform this analysis. We looked at several parameters which we expected to be predictive for gangrene, like disease duration, age and gender, cutaneous subset, diffuse antibodies, history of digital ulcers, but also on traditional cardiovascular risk factors like smoking, cardiovascular acute events, dyslipidemia and diabetes mellitus. And we performed a cross-sectional analysis and also a longitudinal analysis in patients who had any longitudinal data. And in cross-sectional analysis, we found out that a history of digital ulcers, so having had digital ulcers any time during the course of disease, was strongly predictive of gangrene, and also the diffuse cutaneous subset was associated with gangrene, with only a marginal association with history of acute cardiovascular events, which actually didn't reach statistical significance. And then in the longitudinal analysis, we only got longitudinal data for 183 patients, which is a little bit low, but still enough to perform a longitudinal analysis. And we found out in a Cox proportional hazards logistic regression that, again, disease duration and having had digital ulcers previously or at baseline are strongly associated with gangrene. Actually, all patients who had incident gangrene in this study had recurrent gangrene. So this emphasizes the importance of microvascular disease in systemic sclerosis as in the etiology of gangrene, and surprisingly the impact of traditional cardiovascular risk factors was rather low. So I think this sums up our results.
Thank you very much. And can you tell us which was the additional value of having the chance to exploit the EUSTAR database to answer the research question?
So it's a great chance to be in the EUSTAR, I think, when you study systemic sclerosis. Once you are in the network, you know the people and you are able to propose such an analysis. And second, if you need additional data, centers are able to provide supplementary data which are not in the database. So given these advantages, we were able to perform this study.
Thank you very much.
Thank you.